In the 2023 legislative session, the state legislature set aside funding to build up what is called Apple Health Expansion. This is a Medicaid-style program for people who are in the country illegally. And this legislative session, they allocated $150 million to fund it for 13,000 people. So 13,000 people in Washington state who are here illegally are receiving free health care from Washington state taxpayers. House Bill 1482 that would have expanded this program to include all immigrants, not just people who are here illegally. That bill did not receive a public hearing. It's unclear if it's going to receive any kind of public hearing next legislative session or whether it's going to be reintroduced. And this comes at a time when the state is facing a fiscal crisis. It's going to run out of money by 2027 and is going to run into a fiscal deficit of over $400 million by 2028 as of the latest forecast. That is assuming that the state legislature doesn't do anything, but needless to say, they're going to have to change spending priorities in order to offset that if the forecast in September shows they still are at risk of running a deficit. So this program comes at a time when the state is literally running out of money. The Health Care and Wellness Chair, Dan Bernowski, said that his argument was that Washington residents should be on health care and that's the preferred way to do it, because if you have people who are uninsured, they don't go get regular checkups, they don't get regular medical services, and then they experience some sort of medical emergency. They overwhelm the emergency rooms, they put a higher burden on medical providers, and then those costs get passed on to people who actually have health insurance by shifting the costs onto them. So the argument is that this is going to prevent overwhelming services and passing on the costs indirectly, which one could argue that's literally what this Medicaid-style program does, is it passes the costs on to taxpayers to provide health care anyways. So I guess the question is, how are Washington taxpayers going to pay for illegal aliens' health care one way or the other? The Washington Policy Center's healthcare director, Elizabeth New, talked about how the legislative, the bill during the legislative session didn't pass because, as we've talked about, there's no money to expand it right now. But she suspects that there's going to be a push to expand the program, and that they'll find ways of funding it through potentially new taxes.